Hello there. You can see that there's been definite thought about the agenda. We just had Scotland, now you've got Wales. I'm Wendy Dearden, I work for the Bevan Foundation, which is a think tank in Wales. I'm based in North Wales, but Pan Wales, and the office is down in Merthyr Tydfil. What I want to do is tell you about the work that we've been doing, try and set a little bit about the context in Wales, because we kind of lump England and Wales together very often, and housing is very different. And then some of the ideas and recommendations that we've come up with in our recent report. Some will look very similar. I'll talk to you about the ones that look a bit different. Right, press that button for me, please. The Bevan Foundation, I'm not expecting anybody to have heard of us. We describe ourselves as Wales's most influential think tank. I describe ourselves as small but mighty. There are 9 of us, and Welsh governments seem to listen to what we say. We sit in a space of tackling poverty and inequality, and I started work with the foundation 2 years ago, starting to put that in a housing context, and that's quite new in Wales to be talking about housing from a poverty point of view. Press that button for me, please. We're named after this guy, not Michael Sheen, if you've seen Nye at the theatre, but we're not politically aligned in any way, but we very much wear badges of the great Nye and his view of social justice. And press the button again for me. And one of the main things that Nye talked about was having a housing system that looked like the NHS, that there was a house there, suitable, adequate, affordable for everybody that needed it. Press that button for me. So the reason that the lovely Sam invited me to come along here is we get funding from Lloyds Bank Foundation similar to the Shelter Foundation. And our work over the last 2 years, it's slightly different set to what we've been talking about so far. It's saying, how do we actually bring an end to temporary accommodation by boosting the supply of social homes? It's looking at the bigger structural stuff, rather than, I describe it as the duvet of support we need to have at the moment to try and minimise the harm that's going on. And if you look on our website, we're building quite a library. I'm getting too close. We're building quite a library of reports. The first 2 were kind of cases for change. So what's the reality of living in temporary accommodation like? Then a report looking around the shortage of social homes. And then we've done a manifesto report quite recently. You may hear that we've got an election in Wales next year. Please don't ask me any questions about reform. It's a very difficult subject in Wales at the moment for any charity that's trying to stay very neutral. Press the button again for me, please. And then the most recent report that we've done, which is the one that kind of Sam and I had a discussion about, looks very similar perhaps to the report that Shared Health have done, Just Life have done, and the lady from Scotland was just talking about. Perhaps one of the differences I want to say is we've very much brought the voice of frontline officers in. As a former housing officer myself, listening to colleagues, homelessness officers, but also we've brought in the views of, I've described it as a housing report, which isn't really about housing. It brings in the views of community health workers, primary school teachers, and as a housing professional, in some ways it's actually quite positive to hear them talking about housing. Oh, they're getting it, they're getting how important it is. But it's also very depressing in a way because they're having to talk about housing because it's become such an issue. So that's perhaps a slightly different lens that we've taken on it. You press the button again for me, please. These are the stats, which I'm not going to go into now. Our numbers are very small compared to what you're seeing in England. But if you take the numbers away and you look at where the lines are going, it's very similar. Something I think needs to be looked at some point is actually looking at those numbers across the different nations. We have different legislative backgrounds, we have different housing stocks, we have different housing markets, and at the moment those sorts of discussions aren't happening. We have a much smaller proportion of families in temporary accommodation, but since COVID we've been quite priority need neutral, and 2/3 of the households in temporary accommodation are single people. So we've got different pressures going on, but there are things that we could be learning and talking about. Could you press the button again for me? And in terms of the accommodation we're using, this isn't going to look that different at all. We're getting, the B&Bs are starting to go down, but are those figures really being masked by the B&Bs actually being purchased by local authorities? All of the things that you guys have been talking about as going on in your local patches, very similar in Wales. Press the button for me, please. What is different is that housing policy in Wales is devolved. So we start with the 1996 Housing Act, that's our equal point. We had the Homelessness Act 2002, part of that was applied to Wales, but part of it didn't. But since then, we've had a raft of different legislation. When I say different, there's very little tweaks in it. Some of it will look very familiar. But one of the main things since COVID, as I've just said, is that kind of move towards more neutrality around priority need and intentional homelessness. And we've currently got a bill going through, which they're going to try and squeeze in before the election, which will put some of that stuff into law. If you look at any of the consultation responses from people working in the sector, they'll say, this is all fine, but actually what we just need is housing to move people into. And all of the goodwill of, yes, we want to open the safety net up, but how do we open the safety net up without raising more expectation and not having somewhere for people to go? So that's where we come from this very grounded position of we just need more homes. If you could press again for me. This is all going to look very familiar. So this is from the report that we published in September. The themes that we pick up on are child health, learning and development, and family life. And I'm not going to go through those now. If you could go on, I'll just talk about some of the recommendations. So the recommendations that we chose to focus or kind of lump together were removing the risk of serious harm and keeping life as normal as possible. You press the button again for me. And I've tried to put, which you won't be able to see on the big screen, but there are things which are very similar to what has been said. So removing the ability for local authorities to place households in temporary accommodation, which is known to have hazards. At the moment, it is due regard in the legislation rather than prohibiting. We've picked up on the COT idea that shared health have been very vocal about. I've been speaking to community health workers who have told me they've seen families really struggling where there isn't even room on the floor for a cot, let alone a cot. Also, talking about the notification system, we've been calling it a duty to tell. There's something called a duty to ask in our homelessness bill, which is about GP surgeries and schools asking whether homelessness is an issue in a household. We're trying to turn it around and say, yes, that notification system from homeless services should be a duty to tell. Information should be going both ways, is the point that we're trying to make. If you could press the button again for me now. I'm going to focus on some of the things which are different. So we have a national public health service. So whereas in England you'll have local authority level public health professionals, we have Public Health Wales. Now, whereas a lot of good work has been done in England around the child death review process and database, we don't have any of that. We have no idea how many children have died in temporary accommodation. We've estimated, based on the figures that have been presented in England, that it's 1 or 2. And some will say, well, that's quite small, but 1 or 2 is too many, to be honest. So we've asked Public Health Wales to review how that system works, because until we understand how many and the reasons for that, that should all be going into our legislative context in terms of the suitability of accommodation. If you come on again for me. The other one that came through really strongly and was a little bit of a surprise to us was around storage, particularly with health workers. So storage can be provided free of charge by local authorities and is often something that's talked about at the point that perhaps an eviction is taking place and a family just need to move out of a property. However, what community health workers talked to us a lot about was where somebody was perhaps in one room for a large number of months, if not years, just the accumulation of stuff. And for a health visitor to say to me, oh, it's quite often that we see kind of burns from hair straighteners or a baby down on the floor and a load of stuff about to topple over on them just because there's too much stuff in the room. You're almost thinking of a hoarding situation, but this is basically because it's all the space they've got. So we have included a recommendation to Welsh Government about free storage, both at the time of coming into temporary accommodation, but making sure there is enough ongoing storage for the touch that comes with family life. Go along again for me. We have the 6-week rule from the accommodation suitability order, all very, very similar, but that isn't enforced in any way currently in Wales. And also we have the same loophole, I think as somebody described it earlier, that where a B&B is purchased or the type of style of B&B accommodation is owned by a local authority, then it's not part of that regulation. So we've picked up on that as well. If you press the button for me. This is a slightly different one. We have a programme called Flying Start, probably the equivalent of Sure Start in England. Everybody nod at me and just assure me that I know what I'm talking about. So Flying Start is still quite an active programme. It's geographically based, but there's still a lot of money goes into it for support for families with children under 4. There is an outreach element of that programme, and in the guidance it's actually listed that that outreach can be used for homeless families. And I found evidence in Cardiff of that funding being used to fund health visitors who are dedicated to family hostels. Really good practical stuff. It says in the guidance it could be done, but it's very, very piecemeal across Wales about how it is used. And we feel that that really needs to be strengthened. It's a real positive that we've got it. And everybody will be saying, I wish we had it. But we're not using it consistently and we're not making the most of it. Go again for me. And then the final one I want to talk about is play. I believe there's an equivalent of Play Wales, Play England. I think Play Wales is probably doing quite well in terms of the resources that goes into it compared to its English counterpart. Play Wales have done some specific research around temporary accommodation, and the quote up here is actually from their engagement. And what's interesting is how they did their engagement was by providing play packs, working with a number of local authorities. And those play packs were very, very practical things that wouldn't make a lot of mess, could be packed up easily, didn't take a lot of space, but just made something a bit exciting for a child to open, something for the mum to go, that'll keep them occupied for a little bit of time. They use those play packs as an engagement tool, but now want to be able to roll out those play packs to every family that moves into temporary accommodation. They have also advocated, and we've picked it up in our recommendations, that play needs to be a key component in when you assess the suitability of accommodation, because as they say, play is a real tool to help with that trauma of homelessness and just allow that release to happen as you're going through. If you could press the last one for me. I have no idea how I'm doing for time, but I think I'm okay. One of the key messages we do from the report, and any local authority people in the room, I don't mean to offend, I've been there, I know how bad it is, and we put it at statutory services and also at Welsh Government, is that we feel we've almost gone into this culture of, it's all really difficult at the moment and we're doing the best we can. And almost kind of patting ourselves on the back that we're doing the best that we can. However, the number of reports are coming out from us, Shelter Scotland, Shared Health, about the real harm that's happening now, then it's kind of we're doing the best we can, but it simply isn't good enough and we need to be doing better. And the other point that we made is the stuff around temporary accommodation. I can be writing a report tomorrow about the Welsh land and property tax system or the planning system or getting more money for social homes, like many millions and billions of pounds. If I'm talking about bus passes or play packs or anything like that, it's really small practical stuff that doesn't take a huge amount of money. And actually there's very little excuse why we're not doing it now. And that's kind of my rally for arms, and I'm going to stop at that point. Please pop onto our website and have a look at our work.
It's really interesting, isn't it, the similarities and differences across the nations. And bits I was like, woohoo, they're doing, oh no, they're not doing so well. So I really want the Welsh health visiting, I really want the Welsh play packs, and I'd like the Welsh numbers. But yeah, it's interesting to see the impact across the nations.